Immigration in Greenland have been dominating the headlines in recent days, but there's some other key developments in federal health policy as well. The 340B drug discount program, the federal budget, and Obamacare are all back in the news. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. In this episode, we'll visit again with Becky Wifstrand, the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs. I asked her what's been going on after a key 340B decision by a federal appellate court.
The 340B drug pricing program is a federal program that's really important to hospital finances across Minnesota. It originally started in 1992, providing drug discounts for our safety net providers to be able to stretch scarce resources and to provide funding for underpaid services. And so the program has grown exponentially since 1992, with a lot more safety net providers qualifying for it. Some policies have changed over time. And because of that, pharmaceutical manufacturers have wanted to limit the program since they are providing the discounts on the drugs. And so this manifested a few years ago into particularly Johnson & Johnson and some other pharmaceutical manufacturers considering a rebate model for the drug discounts. And so what this means is basically the safety net providers would have to front the money and then get the rebate back on that discount rather than getting that discount right up front.
So like going to Menards to buy your paint.
Exactly. But, as you can imagine, that's difficult for some of our financially strapped hospitals and health systems, because that means they would need to have that cash up front to buy those drugs at full cost and then get that discount. So some of the manufacturers have proposed this in the past. It has been struck down by the courts, and this was in 2024 and early 2025. But after those initial manufacturer proposals, we saw a big shift in that the federal government, HRSA, who oversees the 340B program, proposed a pilot rebate program. And this would be on 10 initial drugs that were also identified from the Inflation Reduction Act, the new Medicare negotiation program.
During the Biden administration.
Exactly. So they identified to pilot a rebate program using these 10 drugs. And so as you can imagine, hospitals and health systems and other safety net providers were really concerned about moving forward with this idea. And so this was proposed last summer. There was a feedback process, and MHA, along with many other providers across the country, submitted comments with significant concerns, especially around those administrative requirements, having to follow up with the drug manufacturers if they didn't issue the rebate. How do we get that money back? We have to make sure the money gets back. We have to make sure it gets back into our bank account. There was a lot of considerations, and especially for our smaller hospitals, just not the workforce to deal with something like this, and especially given it's a pilot program, but the concern that it would expand to other drugs too. And so this moved along in the policy process. It was supposed to be implemented January 1st, 2026, so just a few weeks ago. But in the meantime, the American Hospital Association and some other hospital groups filed a lawsuit against the government for moving forward with this, given all the challenges I just outlined. And so right at the end of the year, a court did rule in favor of the hospitals and halted the start of the program starting in January, which was a huge win. We were very grateful to see that news come through and that our members wouldn't have to deal with this starting January 1st. And then, as you alluded to, kind of the other big development is that the government filed an appeal against this decision early this year, but the latest news is that the government is going to drop that appeal. They're kind of in ongoing negotiations with the American Hospital Association and other hospital groups in terms of what this may look like, and so more to come in terms of the future of this, but at least right now, that pilot rebate program that we were so concerned about is not going into effect.
But this is by no means the end of this struggle. Obviously, they're negotiating with the AHA. I mean, this may be back in court. Will this eventually come to pass, do you think?
Yeah, I think given the rebate model has been discussed in so many different forms throughout the years by pharmaceutical manufacturers, they're not going to give up on this idea. I definitely think it's going to come to fruition in some shape or form. So we should certainly be prepared for that. But sort of this initial proposal by HRSA and what they were moving forward on, it's definitely going to change from what they were proposing.
Now, that wasn't the only action in the federal government this week. Obviously, we're coming up on the end of January when these continuing resolutions from last year expire. Tell me a little bit about what the budget looks like going forward. We all remember the longest federal government shutdown in history from last year. Are we heading for another one? What's the prospects here?
Yeah, just as a reminder, the federal fiscal year starts on October 1st. So Congress needs to pass an annual budget by October 1st. They didn't this past fall. So they've been passing, they had the shutdown, as you just mentioned. They've been passed a continuing resolution then, which extends existing federal funding levels rather than their new budgets. And so now that Congress is back from the holidays, they are working on that fiscal year 2026 budget. However, it seems like they're running into some hiccups. There's obviously a lot of politics at play with some of these provisions in all the different the funding areas of the government. And so right now, the continuing resolution expires January 30th. They either have to pass the full year funding bills by that date or another continuing resolution. And so given sort of the latest we've been hearing this week, I think that it's probably more likely they'll pass another continuing resolution. I'm not sure they'll be able to get their work on time, which unfortunately has been, a common theme in the past few years, is that Congress has been stuck in these negotiations and has had to continue to just extend until they reach that agreement.
Now, this last shutdown was a little different from some others. There wasn't as many continuing funding efforts going on. It was a little more of a button-down shutdown. Do you think that a new shutdown will be any different? Will there be, for instance, impacts on Medicaid or Medicare that we haven't seen before? What kind of a shutdown would it look like?
Well, it would still take the form as sort of the standard government shutdown. But if you remember, the biggest sticking point in this past government shutdown was the Affordable Care Act enhanced premium tax credit subsidies. And, Democrats really dug in onto that issue because Congress did not come to an agreement on extending those. And so you ask what would be different about this shutdown. I think it would be dependent if they're able to get to an agreement on that issue, on the tax credits, because that still hasn't been resolved. Those expired December 31st, and they're still working on it. You may have seen in the news last week, the House of Representatives did pass a 3-year clean extension of those enhanced subsidies. The Senate will never agree to that policy, but
with some Republican support. Obviously, those nine GOP members crossed the aisle to pass that extension.
Yeah, because a lot of members are hearing from their constituents. It's affecting a lot of their constituents that buy insurance on the individual market. They're seeing those big premium increases now that we're in the new year. And so it's an issue that's not going away. They're not going to ignore it because they're going to continue to hear about it. And so the Senate is now working across the aisle. They're trying to negotiate a compromise on what an extension may look like. The latest I've seen is potentially a 2-year extension with some other policies baked into that. A lot of Republicans have been talking about the health savings accounts, using that as a tool for these subsidies. And so that could be embedded in whatever the Senate agrees to. So,
and I think some income limits as well.
Yeah,
right?
Exactly. So I think back to your original question, if the Senate can come to agreement and then they get the House on board all within these next couple of weeks, that could potentially really change the dynamic in terms of talking about the budget and the federal funding and hopefully potentially avoiding another government shutdown.
So that's the news on the ACA subsidies. But obviously that wasn't the only thing going on in Washington. There's been some news that CMS is pausing some Medicaid funding as well, more than a dozen programs in Minnesota. Who does that involve? What does it mean? Where is that?
Yeah, so this has obviously been an issue for several months that the state has identified 14 high-risk Medicaid services that have been concerned about fraud. And this is largely services that don't really affect hospital services, but like housing stabilization and some of the autism services and community-based supports. So this has been an issue for a while. And then the announcement last week was that CMS is pausing the payments for these services, given that they believe that Minnesota's corrective action plan was insufficient. And so the most recent news is that now that CMS has indicated that the State Department of Human Services is appealing that decision. And so the formal process is that they appeal that decision and then CMS will schedule a hearing to discuss this issue. And so I want to make sure our members are aware of that, just so that this is going to become kind of a high focus issue for our state and, may trickle down into hospital services.
As for instance, if housing support is reduced, people may wind up in the hospital, may be more likely to wind up in a hospital, or a patient may not be as easy to discharge, right?
Yes, and just being aware there may be increased scrutiny on Minnesota's Medicaid program by the federal government. And we all know that hospitals are not the problem. They're not engaging in these fraud activities, but it is important to be aware of sort of that global landscape.
Well, we'll keep an eye on it and hopefully have you back soon to tell us more.
Thanks, Tim.
That's Becky Wifstrand, the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.